Hello, my name is Darcy Flores, and today I will be presenting diabetes type 1. I will be starting with my introduction. According to the Centers of Disease Control and Prevention, having diabetes type 1 refers to the pancreas producing no to little insulin. Insulin is a hormone that helps blood sugar enter the cells in your body where it can be used for energy. Type 1 diabetes, previously called insulin dependent or juvenile diabetes, is usually diagnosed in children, teens, and young adults, but it can develop at any age. My continuation currently is still unknown how to prevent type 1 diabetes, but it can be managed by following your doctor's recommendations for living a healthy lifestyle and managing your blood sugar. It can take months or as long as years for enough beta cells to be destroyed before symptoms of type 1 diabetes are noticed. Type 1 diabetes symptoms can develop in just a few weeks or months. Symptoms can be very severe as soon as they appear. And then we have diagnosis. Numerous tests are done to diagnose a person with diabetes. Normally, the first test focuses on the hemoglobin protein called A1C. In addition to a urine test for ketones can show that the body is breaking down fats and proteins for energy. Diabetes can also be diagnosed by testing blood glucose. Normally, the body tightly regulates glucose levels so they remain within a very close range of 90 and 110 milligrams in deciliters. Testing for beta cells or insulin antibodies produced by the immune system. This test will confirm that a person has type 1 rather than type 2 diabetes. Then we have three main treatment options, which are injecting insulin, insulin pumps, artificial pancreas. The insulin cannot be orally taken because it is digested by acids in the stomach. Insulin pumps. An insulin pump is worn on the body, delivers insulin through a small tube inserted into the skin. Then we have artificial pancreas. In 2016, the Food and Drug Administration approved this device for individuals over 14. This device combines a glucose sensor implanted under the skin, an infusion patch, and a pump. The sensor monitors blood glucose levels in 5-minute intervals. All right, we'll continue with forms of insulin and its duration. So we have the rapid acting insulin with 2 to 4 hours, short acting insulin, which is the regular insulin, 2 to 3 hours, and 3 to 6 hours. Intermediate acting insulin, long acting insulin, ultra long lasting insulin, premix insulin. Then we have long term complications. I'll be moving my screen. This includes diabetes increases the risk of cardiovascular problems, stroke, and hypertension, which means high blood pressure. Excess blood glucose can damage the capillaries leading to nerves, causing neuropathy. This disorder may cause pain, other uncomfortable sensations, commonly in the legs or feet. Neuropathy from chronologically high blood glucose can eventually lead to numbness in the limb combined with reduced blood flow. This may lead to increased infections that, if left untreated, may require amputation of affected body parts. Okay, and then we have the same thing, beta cell destruction causes type 1 diabetes, which we discussed in the first couple of slides. Then we have a short clip that I added so you guys can enjoy it and have more information about type 1 diabetes. Then we have summary. Diabetes may lead to amputation of different body parts. Not taking insulin may cause weakness, fatigue, excessive thirst, and blurry vision, discomfort in feet and legs. Diabetes is caused by white blood cells destroying beta cells, like we discussed. Type 1 diabetes is mostly diagnosed on children, juveniles, and young adults. The most used option to take insulin is by injecting it to the body. Then we have my references, where you guys can see where I got my information from. And I hope you enjoyed my slideshow. I hope you learned something. And thank you very much.